cut the trapezius muscles right next to the vertebrae and reflect them laterally. Got me there. Okay. So a best practice is to lift the trapezius muscles first to do it. I'm actually going to do this. We cut the, what's this muscle? So lift right next to the vertebrae the best you can. Of course, this is way harder when you're right-handed. Okay. You want to reflect both the spinotrapezius and the acromiotrapezius.
Not too much. She just told you so.
And when you do, God, this kind of sparkles a lot of fat now. Okay, when you do, this should come out. What is that? What's that thing? Very scapula, very good. All right, the scapula will come out. Okay. All right, towards the vertebrae from the scapula, you're going to see a group of muscles that look like pulled pork.
Great. Noted.
Yes, dude. Look, that looks like pulled pork.
It's not the pulled pork I want to say on my plate.
It looks like. I'll tell you. You know, pulled pork is muscle that you're eating.
Thanks.
All meat is
Never
muscle.
eating pulled pork.
Any meat that you eat is muscle. All right, these are called your rhomboids right here. All right, they're connected from your scapula to your vertebrae. Does everybody see your rhomboids? Pulled pork there. There are three groups of rhomboids. There is going to be one in front that I need you to pull away. You just kind of pluck at it until it comes out like a little guitar string. See, that string just came out. This rhomboid is the only rhomboid that has a different origin. All right, all the origins for the rhomboids are your vertebrae except for this one. The origin for this one's actually the skull. Okay, so what rhomboid is this? Knowing that little factoid. That is called your rhomboidus capitis. Very good. That name makes sense, right? Okay, which leaves a rhomboidus major and a rhomboidus minor. All right, we named these muscles after cats or people. People. So the name will make sense for a person, but might not make sense for a cat. Okay. Right past the rhomboidus capitis, we have this bigger muscle, this bigger pulled pork right here, that takes up the whole medial border of the scapula going to the vertebrae. Do you think that is the rhomboidus major or minor, since it's so big? It's actually the minor. Okay. In humans, this is much smaller. In cats, that's not the case. So the rhomboidus minor is actually bigger on a cat. Here is your rhomboidus major below it. Okay, it's this darker rhomboid right here. So an easy way to tell one from another is that the rhomboidus major actually starts at this structure on your scapula. Does anybody recognize this structure down here?
Oh, inferior angle.
Very good, that's your inferior angle right there. All right, your rhomboidus major starts at your inferior angle and then goes to the vertebrae. Okay, so follow that first to see the separation between the major and the minor. Okay, good there? All right. From the inferior angle, but now going the other direction, there is another muscle that looks similar to the rhomboidus major. Does everybody see this little muscle right here? Okay. Right there. This is called your teres major. So both majors start from the inferior angle. The rhomboidus major starts from the angle, goes this way. The teres major starts from the angle and goes this way. Okay. All right, I need a volunteer. You're right next to me. That's what I'm. I would like you to feel right here and tell me what you feel. Please. What is that? It's part of the bone. What structure? Anybody else want that?
Yosan wants to try.
Okay. Here, go ahead. Let me get it.
Where? Right here?
This structure right here. What are you feeling?
I have.
That is the scapular spine. Very good. All right, you can feel the scapular spine. If you get enough muscle off it, you'll see the scapular spine. So if you see that, do you remember the fosses of the scapula? What was the fossa that was above the spine? Supraspinous fossa. What was the one below the spine? And what was the one that was in front? Subscapular. Well, there's muscles that fit in those fossas, and the muscles are named after the fossas. What do you think this muscle right here that you see in this fossa is going to be called? It's above the spine, so supraspinatus is in the supraspinous fossa. What about this one? Infraspinatus. And what about the one that's in the front? Subscapularis. Very good. Okay. The teres major, the infraspinatus, the supraspinatus, and the subscapularis make up a group of muscles that we call the rotator's cuff. I'm sure you've all heard of that before. They are responsible for your circumduction of your shoulder, and it's pretty easy to tear. All right, especially if you use your shoulders a lot. All right, so that is the next group. Let's do a recap. What is this right here? Capitis. Very good. What's all this right here? Rhomboidus minor. What about this darker one coming from the inferior angle? Rhomboidus major. What is this one coming off the inferior angle? Teres major. What's this muscle right here in this fossa? Infraspinatus. And on the inside. All right, let's go ahead and do that now. Remember those trapezius muscles.